name's Malia. I'm going to go over some discharge instructions with you since you just had your new baby boy. Congratulations.
Thank you.
Alrighty, so we're going to start with your teaching for your discharge instructions, and then we'll move into baby, okay?
Okay.
We're going to go over various things such as infection signs and symptoms, things to call the doctor about, big emergencies, and just basic care for your new baby, okay?
Okay.
Alrighty, so first we're going to start with peri-care and tear care and some medications, okay? So because you sustained a first-degree tear, we should discuss how you will care for this wound at home to ensure proper healing. As a basic rule of thumb, we want to keep your area and your perineum clean and dry. The perineal area is a high breeding ground for bacteria due to sweat, urine, discharge, and stool. So immediately after each urination or bowel movement, you should cleanse the area gently with mild soap and warm water, and then rinse and gently pat dry. We want you to avoid products that may cause irritation or lotions and creams that will keep the area moist. You can apply ice packs to the area with a barrier, so such as like a towel, in between to decrease pain and swelling, but never place the ice packs directly onto your skin because they can be too harsh directly on the skin. You may also apply this spray that we have called Dermaplast. That will go on your perineal area after cleaning and drying to provide pain relief. This can be applied up to 6 times daily or as directed by your doctor. So when you're using this, be sure to hold the bottle 6 to 12 inches away from the skin. And then the same cleansing care will apply for your hemorrhoid. We are sending you home with a stool softener. This is called Colace. You should take 50 to 500 milligrams per day divided into 4 doses or just as needed to aid in softer bowel movements so that we don't irritate that hemorrhoid and we can avoid straining. We want to avoid sitting on the commode for longer than a few minutes if you're not able to pass the stool. In addition, you will be able to apply Tux pads to your perineal area after cleansing and drying and after each urination or bowel movement to aid in pain relief due to your hemorrhoid. It's very important that you change the pads and cleanse the area at least 4 times a day. You may also promote healing time by using a peri bottle filled with warm water to soothe the area during urination or during bowel movements. Some patients like to sit in a sitz bath for 15 minutes following bowel movements. Your tear in your hemorrhoid will likely take several weeks to heal. You should frequently assess these sites for signs and symptoms of infection. So labor is really hard on the body, so some redness, pain, and warmth and swelling in the perineal area is normal, but it's important to be able to distinguish the expected symptoms versus signs of infection. Some signs of infection that indicate you should contact your doctor or your certified nurse midwife include unusual yellow or green discharge from the wounds, a foul odor, persistent pain, excessive bleeding, or a fever that we call a fever over 100.4, or separating of the wound after it has previously been closed and healed. You also want to look out for excessive redness or warmth in the area. So some signs and bleeding that would require immediate medical attention would be, vaginal discharge in the postpartum period is known as lochia. It's a combination of blood, mucus, and uterine tissue. So although lochia is heavy at first, it'll gradually lighten up over time. Initially, lochia will be dark red, and then it'll move into a pinkish brown color, and then finally it will resolve after a few weeks of just like a light yellow color. Passing clots after delivery is normal, but they should be small and resolve within a few days. If you're passing clots larger than a golf ball, you should contact your doctor. Gushing of blood that sometimes occurs upon standing after you've been laying down for a while, like if you were resting or sleeping, that's normal just because your blood can kind of pool in the vagina when you're resting or laying down for a long time. The bleeding usually lasts about 6 weeks after delivery, but it can last up to 12 weeks. If you experience worsening pain, uncontrolled bleeding, severe headaches, fever, any shortness of breath or chest pain, vision changes like blurred vision, we want you to contact your doctor immediately. All right, so since you are breastfeeding, we want you to feed your baby according to the individualized feeding plan recommended to you by your baby's pediatrician. So following a schedule is crucial for baby's nutrition, especially in these early days. You may have to wake your baby to ensure that they're getting enough feeding sessions each day, or they may cluster feed, they're adjusting to life. Flexibility and perseverance are super important when learning to breastfeed because your baby's learning just like you are. Breastfeed frequently and aim to feed for at least 10 to 15 minutes on each breast per feeding. Initiate breastfeeding sessions by pumping or manually expressing the milk from your breast. And if a feeding is missed, it's important that you hand express or pump the milk because this will help maintain your supply, your breast milk production and prevent mastitis. It may be helpful to use warm compresses before breastfeeding because this kind of allows the ducts to open up and allow the milk to flow easier. If you experience discomfort while breastfeeding, you may apply cold compresses following feedings. This can reduce swelling, and you can also apply nipple creams or ointments such as lanolin. Wearing a supportive bra during this time may help support your breasts as they will likely be fuller and heavier because you have increased supply. Bras can also help with leaking during the night or between feeds. And burp your baby when switching between breasts or once they finish eating. And if concerns arise, you can contact your doctor or your lactation consultant. All right, I know it's hard to think about activity this early, but some light activity is encouraged and it's helpful and very, very beneficial during the postpartum period. This helps strengthen those abdominal muscles back. This will help improve your sleep and relieve stress. It can also aid in prevention of postpartum depression. An easy goal for you to do is 150 minutes of activity per week. So for example, you can take 2 15-minute walks per day, 5 days a week. Because you had a healthy vaginal delivery, you can begin this within a few days or whenever you feel ready. With that being said though, it is important to pace yourself and be sure to get plenty of rest because this will help with your healing process. If you feel dizzy, experience pain or excessive bleeding, or you're feeling weak, stop your activity immediately and contact your doctor and then resume activity as tolerated or as directed by your physician. So speaking of postpartum depression, feelings of sadness or tearfulness after delivery is expected. You're having a drop in hormones. This is called baby blues. This is a common experience among women and it should resolve around 2 weeks post-delivery. Postpartum depression is a little bit different as it takes longer to resolve and this greatly impacts mom's life. We have some guidelines that we'd like to make you aware of just so that if you notice the signs, you can take note of those and contact your doctor. So some signs we use to diagnose postpartum depression are depressed mood is observed and present for most of the day. If you have a loss of pleasure or interest for most of the day. If you have sleep disturbances, so you're sleeping too much or not sleeping enough. Some psychomotor retardation or agitation. If you feel worthlessness or guilt. If you have loss of energy or fatigue. If you have any suicidal ideation or attempts or recurrent thoughts of death. Impaired concentration or indecisiveness, or if you have any significant weight or appetite changes, so like 5% over a month of weight gain or loss. So for driving, since we've had a baby and we've had some pain medication, you can typically drive as soon as you've been off pain medication for 24 hours and as soon as you feel comfortable. So just use your own discernment with that and make sure you've been off pain medication. And we will see you at your doctor, or you should see your doctor 6 weeks postpartum for your postpartum checkup. You see them in the first week, and then you will go for your 6-week postpartum checkup after that. Okay, now to your baby's teaching, all the things. So it is normal for babies to intake about 1.5 to 3 ounces of milk every 2 to 3 hours. and this will increase as baby grows. So just make sure they're getting enough in, and then they should have at least 6 to 8 wet diapers per day, but 10 or more is considered normal. And in the beginning, they will have 3 to 4 bowel movements a day, but we don't consider them constipated unless it's over 2 days without a bowel movement.
Okay.
For the umbilical cord, there's a few precautions you should take regarding that stump that's still there. So the stump will fall off within 1 to 3 weeks after delivery. No routine cleaning is necessary, but if it becomes soiled, we want to wash it off right away with water and gently pat it dry to prevent infection. We do want to avoid submerging your baby before the stump has fallen off, so no baths, just sponge baths until then. We want the stump to completely dry and heal up before we submerge them. And then be sure to also tuck baby's diaper below their umbilical stump. And if you notice any redness, odor, drainage that looks infected, anything like that from the cord, we want to contact the doctor. It is normal to see a small spot of blood on the baby's diaper once the cord has fallen off, but as long as it's just a small amount. For baths, babies typically only need about 2 to 3 baths per week in the beginning because they have very sensitive skin. Sometimes it helps with baby's fussiness during baths if you make sure the room is warm and you're using a mild soap and getting between their skin folds, especially in the neck because milk can dribble down. And be sure to wipe baby's eyes from the inner corner to the outer corner. We never want to wipe from out to in. And use a soft washcloth with this. All right. So the stress of having a new baby is very frustrating at times, but it is very important that you allow yourself breaks when people in your support system allow you time for yourself. Sometimes it can feel very defeating when your baby will not stop crying, but it's never okay to shake your baby under any circumstances. Shaken baby syndrome is a brain injury that can happen due to the newborn's weak neck muscles being unable to tolerate the whiplash motion. It can cause newborns to die, or at best, they can cause serious developmental delays or irreversible physical trauma. Some signs of shaken baby syndrome that you should look out for are difficulty staying awake, extreme irritability, difficulty or cessation of breathing, so if they're not breathing anymore, if they're having seizures with vomiting, if they appear lifeless, or if they have tremors. So if you shake your baby, or if you are concerned that someone else has shaken their baby, you need to call your baby's doctor immediately. For sleep, babies should be placed on their back for sleep and should not have any pillows, blankets, or stuffed animals in the crib or bassinet with them. I know the little crib bumpers are very cute, but it does increase their risk for SIDS, which is sudden infant death syndrome. So we want to avoid those. Sudden infant death syndrome is the unexplained death of a baby. Some other ways to avoid SIDS include breastfeeding, attending routine well checks for your baby, and not smoking around the baby. Co-sleeping is not recommended due to the increased risk of SIDS, and some people may accidentally roll over onto their baby during the night. So we want to make sure we're promoting safe sleep. For baby's temperature, the normal temperature for a newborn ranges from 97.6 to 99.6. They may fluctuate throughout the day or if they're crying. It's not necessary to take your baby's temperature unless you suspect that they're not feeling well based on their demeanor, if they're super fussy or just not acting like themselves. An increase or decrease in temperature can indicate that your baby could have an infection, and this should prompt calling your pediatrician. So when you take a baby's temperature, we don't want to put it in their mouth. We want to do it underneath their arm. And since they are so small, just make sure the temperature probe doesn't go right past their armpit. We want to make sure it's under there good. So for your baby's circumcision, it's normal for the penis to be slightly swollen and red, but it should heal completely in 7 to 10 days. The penis is typically covered with petroleum gauze to avoid the skin from sticking to baby's diaper. Because this is a wound, we want to follow the same basic rule of thumb, which is keeping the area clean and dry. If the wound becomes soiled with stool or urine or anything, we want to gently clean it and pat it dry before replacing the petroleum gauze and diaper. We do want to avoid using soap or wipes on the wound, as these products can be irritating to the fragile skin that baby has. Some signs of infection are fever, redness that does not resolve, a foul odor, yellow drainage or crusty sores, and a swollen penis. So call the pediatrician if you suspect your baby may have an infection. For the car seat, we want to make sure that it meets the federal safety standards. Typically, fire stations have programs to assist in checking the installation of your car seat. Newborns should be rear facing in the car seats until about 2 years old. Always be sure you're placing your baby in the appropriate size car seat and fastening the seatbelt properly. So since baby doesn't have much of an immune system yet, we want to make sure we're practicing very good hand hygiene to stop the spread of germs. This is the #1 way to prevent infection. So make sure you're washing your hands for at least 20 seconds with warm water and soap so that they're properly clean before holding baby or touching any of baby's items. This is an important teaching point for all friends, family, children, anyone in your support system, anyone that's going to be around baby. Stress this to them heavily. And if you have any pets, specifically pet reptiles, we want to keep them away from your newborn because they carry salmonella. Yes. Airway clearance. So if baby needs assistance clearing their airway, so nose, mouth, after feeding, or if they have, nasal secretions, you can use a bulb syringe. You may use the syringe in baby's nose or mouth, but squeeze it first before inserting it into the nose or mouth, and then release it to suction. Empty the syringe, clean it out, and repeat the process. Be careful when you're using this device in baby's small airways though, because you can easily cause damage or activate their gag reflex. Now we're going to talk about some symptoms that require immediate medical attention. So some things that you should immediately call your doctor about would be a temperature under 97.5 or over 100.4, violently vomiting or vomiting blood, less than 6 wet diapers in 24 hours, if they have blood in their stool, if they refuse to eat for 2 feedings in a row, or for more than 2 feedings in a row, if they do not have any bowel movements in 48 hours, if they have more than 2 liquid stools in 24 hours, and then if they have a swollen stomach that doesn't resolve, that's important to address too. If baby's ever unarousable or excessively sleepy, we want to call. If they're inconsolably irritable, we want to make sure that we're checking on that as well. And then if they have a runny nose or cough or swelling or drainage of the eyes, or any new sores or blisters of the skin. And then there is this thing called thrush, which is white patches in the mouth. This is a yeast infection. It's very painful. This can affect their feeding greatly, which is huge. So we want to make sure we call if we see any of that. And then something to call 911 about would be if baby has blue lips or is having trouble breathing or cannot breathe. All right, and then for routine follow-up appointments, baby will have a few follow-up appointments moving forward. This will happen when they're 3 to 5 days old, 1 month old, 2 months old, 4 months old, 6 months old, 9 months old, and 1 year. That's all written in here so you can easily reference it, and your pediatrician should schedule with you appropriately. Do you have any questions about the teachings we went over?
No, that's really detailed. Thank you so much.
You're welcome.